Hello, this is Dr. Orlando Landrum, again with Take Back Your Life Thursdays. And today I have the pleasure of having a phenomenal guest here to join me, and that's going to be Nicole Dyer from CryoEdge Elite. We're going to be talking all about cryotherapy, really getting into the nitty gritty of how it can be able to provide benefit to a whole host of different individuals. What are some of the uses? And hopefully we'll get some questions from the audience, those viewers who are watching, to really be able to get your questions answered and a full understanding about what's going on and how we can be able to provide value to people here in the Michiana community and greater. So this is Nicole Dyer from CryoEdge Elite. Thank you so much for joining. Really appreciate you being here with us. And I'm Dr. Orlando Landrum from Cutting Edge Integrative Pain Centers. Thank you so much, Nicole, for being here with us.
Thank you for having me.
You don't mind if I embarrass you a little bit and talk to people and tell them about, some of the aspect of your accomplishments and how you kind of got to this state? Is that okay?
No, that's perfectly fine.
So what I have from your website is that, you actually can really be able to identify and empathize with a number of people because you've had both neck as well as some knee pain from what I understand it. And you sought traditional medicine in some different ways, but not trying to really knock myself or my colleagues, but sometimes we weren't always the most integrated in trying to be able to treat some of the conditions and problems that you had. But to kind of really sort of attest to the things that you've done is you've been a firefighter, you've been a canine handler, you've been an investigator, and you really provided this aspect of service to the community. And what we're hoping to be able to do is to be able to kind of give you some of that back in terms of being able to help you with some of your trials and tribulations. But you had to kind of find your own resources in terms of being able to help yourself. And so you came to this aspect of cryotherapy, and you really decided that it was so beneficial. It seems like you decided to kind of bring that here to the community to be able to help others. Is that right?
That is correct. That's correct. A lot of my life experiences is what has brought me to trying to figure out my health and be an advocate for myself and really looking at what the root cause of the issues were that ended up manifesting into some type of physical issue.
Wow. Okay. So we've already had a comment already come up, and it's from one of our patients who is always supportive of us, Miss Vicki Woods. We appreciate you being here, and I'm pretty sure you're going to get something of value that's going to come from this. So let's kind of get into the nitty gritty of talking a little bit about what's going on with you and how we can be able to answer some of the questions that are in place. Really what we want to talk about is cryotherapy and aspects of pain. It doesn't just have to be back pain. It doesn't have to be neuropathy. It can be a whole host of different things. But I know my patients would love for me to shut the heck up and just ask a few questions. So I'm going to just say, starting right off the bat, what exactly is cryotherapy, and where was cryotherapy invented? Can you give us some background on that?
I can. Cryotherapy was invented right around 1978 by a medical doctor in Japan. And he designed it to help people with any type of inflammatory issue like rheumatoid arthritis, fibromyalgia. He, at that time, focused more on rheumatoid arthritis. It came into the States about 10, 15 years ago. It hasn't been real popular until now. You see it a little bit more in like Chicago and California and some of the bigger cities. Basically what cryotherapy is, it's a process of using liquid nitrogen to cool the body, hypercool the body, and it kind of tricks the mind and the body into thinking that it's actually going into hypothermia. And so it puts that body into, I know it sounds kind of scary, but it's really not. It puts that body into that fight or flight mode. And so it pulls all the blood to the core from the extremities, oxygenates it. And then once you step out of the chamber, all that fresh, enriched, oxygenated blood goes to where it needs to heal.
Okay. All right. So just for our people who are joining us, I want to make sure that individuals understand exactly who and what we have going on. So this is Nicole Dyer from CryoEdge Elite. who's going to talk to us a little bit about different things, just because I know some of you guys are really about trying to figure out things and get on top of it ahead of time. I want to kind of show her website. So CryoEdge Elite is listed right here. And you can be able to kind of see as we sort of scroll down, there's a whole host of information that you can find there, but don't skip ahead, stay with us. But to kind of give you a little bit of a teaser, there are a number of things that cryotherapy can be utilized for. And as she kind of stated, it can be everything from workout recovery to whole body wellness, to weight management, to mental well-being, to pain management, which we're going to talk about today, to reducing signs of aging. And this is our location, but we're going to come back to that. So stick with us. Don't leave us just yet. But we're going to talk about some of those things and really kind of get into the nuanced nitty-gritty of it all. Did I do a pretty decent job? Is that okay, Nicole?
Yeah, that's great. You did great.
Okay. All right. So when you mentioned the aspect of hypothermia, I thought immediately, well, how cold does cryotherapy get? Because you could see this on like TV and the movies where you see like typically some really built football player that's getting out of this cold cryotherapy and they look like they're just like dying. So tell us what the real deal is and explain it to us.
It is cold. And my daughter's going to come in towards the end of this, and I can actually run her through there so everybody can see too.
Very cool.
If they want. It does get cold. I'm not gonna sugarcoat that. It's kind of, you know how people say Arizona is a dry heat versus the humidity here. It's very similar. It is a dry cold, but it's still cold. One of the misnomers with cryotherapy is I have people that have arthritis and they're like, oh, I can't do cold makes me hurt worse. This is different because it's a dry cold. It's not that bone chilling cold that we get in the wintertime. So with my chamber, which is right here, it has 3 levels. It does -90 to -130 on the level 1, -130 to -166 on level 2, and -166 to -186 on level 3. Normally, I only run people through level 1 and level 2. I only have one individual that requests level 3, and he's a professional CrossFit. I mean, he comes in 3 times a week, but he just is a professional workout person, performance athlete, and he doesn't do that cold every single time. But the purpose of it is we want to drop your body temperature about 30 degrees. And then what it does is, like I said, it pulls everything to the core, enriches that blood, and then sends it out to the extremities for the healing. And it really zaps the inflammation out pretty quickly.
All right. So we're going to leave that level 3 as the CrossFit Elite level. And we're going to talk about that level 1 and level 2. But before we really kind of get into this, you know, I think for many people, whether you're a patient, a client, whatever, it's incredibly impactful when someone understands where they've been and how they got to this point, right? We hear frequently people talk about someone's why and how they got there because it matters for the how and what they do. So can you tell us a little bit about your interesting background and how you found out about cryotherapy and what pulled you into it?
Sure. I'm going to go back a few years. Before I got on the fire department, I worked, a friend of mine that was helping me get on the fire department. He was training me to get in shape for the fire department, actually had a health food holistic store. And at that time, he asked me to work for him. And I said, well, I can a little bit, but I really want to get on the fire department because I really want to help people. So I became a firefighter and EMT, and then became an investigator. And that's been about 25, 30 years that I've done that. And during that time, helped a lot of people, but also I was injured on the fire department. I fell, and the air bottle, the SCBA bottles that we wear, I snapped my head back and the bottle hit me here in the back of the neck. So I herniated my C1, 2, and 3 and ended up with severe migraines. So no matter what I did, I could work out, I could do my job, but if I was under a lot of stress, I'd be down for the next 3 days with a migraine. With that being said, I also lost the hearing in my left ear. I lost the low frequency and the high frequency, and nobody could, they, to this day, they still can't tell me why, other than they think it's a nerve issue. And I actually think they're right, because there's some days that I can hear better than others. Let's fast forward a little bit. I've been really beat my body up really bad. I have 2 knees that need replaced and torn meniscus in both. And I shredded my Achilles in my right leg. And then I had a trauma to my calf, my shin on my left leg, that left me with a calcified blood clot the size of a baseball. And so they removed, sorry about that. They removed the blood clot, but it still left me with a lot of pain, and I still have a few issues. So with all that being said, my whole body's just full of inflammation. And a few years ago, I went back to school because I wanted to start with my gut health and diet. Throughout those years, I got really, really heavy, very depressed. Just couldn't, I was depressed because I just couldn't get back to my active lifestyle from all the injuries. And so I started and went back to school for health coaching and nutrition, worked on that aspect. Then I went back to school for, it's called Pangu Qigong, and been doing some of that. And I went back to school for some emotional alchemy type of things, because being a firefighter and an investigator, I was an investigator not only for Elkhart, but for multiple states. I went all over the area. So I saw a lot of things. And so I went to school to learn that. I've also do crisis intervention for a victims advocate group too. So with all of that experience, it's taught me how to help people look at all aspects of their body, their emotional part and their physical part. Because after learning all these things, I've learned that it's all connected. So then my daughter is an athlete. She is a runner, was a runner in high school, is now a runner in college. And so I was looking for something to keep her fit and keep her healthy, because as everybody knows, in high school, they just run, 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 run. And I'm like, she wants to run in college. We have to figure out a way to keep her healthy. So throughout all of that, I didn't want to have knee surgery. And actually, my doctor at the time said, I don't want to replace your knee, because with your active lifestyle, wanting to get back to where you were, we're going to have to do it several times. And so we were out west or out east, and I came across a place that had cryotherapy. And so we decided.
Where was that?
It was out in Washington, D.C.
Okay.
We were out visiting my son. And so I tried it, and I couldn't believe it, because my knee pain actually went away. The first time it was only gone for about 6-7 hours, but it was like, oh, I felt wonderful. And while we were out there for a week or two. I tried it again. And each time that I did it, I could last longer. Now, since I bought one, I do it about every 3 weeks, depending on how much I abuse and work my knees and my body. But I can get by every 3 weeks, once a month now. So when we were out east, somewhat talked to my husband about doing this, but I'm one of those that if I get something in my head, I just do it. And he kind of knows not to say no, because if he says no, I'll do it that much quicker. And so we decided to buy this, bring it home, and here we are. So.
All right. Wow. Fantastic story.
Sorry, it's a little long, but.
Not at all. I think that aspect of inflammation and being able to hit multiple different points, I know our watchers and viewers are going to ask, that range, and does it differ depending on different things? But I'm sure we can get into that in just a second. I have someone who's asked me a question twice, because she wants to make sure that I am on point and that I'm not missing anything. So I'm going to show her question. And that is Vicky. She says, does the cold trigger Raynaud's? So for those of you who may not know what Raynaud's is, it's an autoimmune component that can be able to change the vascular blood flow that's present, particularly in the digits. It's very prominent within the context of the hands, but it's normally exacerbated during the context of cold weather. So I'm sorry, Nicole, you were going to say.
No, you're right. It does trigger that. That is one of the contraindications of cryotherapy is Raynaud's. I have ran some people through that have it. My daughter actually has it too. I just have to be very conscious, depending on how bad they have it. And we just kind of have to experiment a little bit, and that's probably not the right word to use. I normally will only run somebody like that through on level 1, which is the lowest level of coldness, and then I will double glove their hands, and we will double glove or double sock their feet if they have problems that way. I have another patient that also has it, and she comes in probably about every 3 months. And again, we have to do it on a cold setting, and we just have to really watch to make sure that they can get that circulation back in their fingers. It just takes a little bit longer.
So there are people who can do it even with Raynaud's. They can find ways around it. Mm-hmm. Maybe. Okay. Mm-hmm. All right. So, and this one I think is maybe a little bit tougher because I think there's a bit of a mind-body connection, but you obviously have experience in that. So how does cryotherapy work to relieve pain?
So it like I said, it pulls everything to the core with the inflammation, but it helps, especially with like RA, fibromyalgia. It helps with the, it just left me, the alpha gamma, the, what am I thinking of? The, for the neuropathy, the alpha gamma, the, not that nerve, but that peripheral, and kind of takes that nerve and doesn't really deaden it, but it makes it cold and it resets. There's a lot of studies now where it will reset the vagus nerve also, which helps with your parasympathetic and sympathetic nervous system.
Very much so. And so that vagus nerve now is only recently starting to be evaluated from pain physicians because they're looking at non-invasive stimulation of the vagus at the neck to be able to help for a whole host of different problems, including headaches and other things along those lines. Actually, Peter Staats, who used to be from Johns Hopkins, is one of the most influential figures in that. So we have another question coming in. So I want to make sure their questions get asked and answered before I get my questions in. So let me kind of pose this and put this forth. So we have a question from Connie who asked, is this a problem? And I know she made a revision for it, but is this a problem for AFib is what she's asking, for atrial fibrillation?
Yeah, that again is one of the contraindications that we have to make sure that it's okay with their physician that they go in, that they're able to go into the cryotherapy. Because it will slow things down. Like I said, it helps with the vagus nerve, and it'll drop your blood pressure and it'll slow your heart rate down a little bit. Unless I have somebody that is really, really nervous, sometimes their heart rate speeds up the first time. But the nice thing with this is I'm right there with them. They can get out at any time. It's not like I lock them in there and walk away. I'm there with them the whole time. But it will slow things down a little bit. So another contraindication is a pacemaker if they've had a heart attack in the last 6 months, if they've had a stroke or they have like a cerebral hemorrhage. We've been wanting to get, my dad's wanted to try this, but we just found out that he has a brain aneurysm. So it's like, yeah, we're not putting you in there right now. So, but the really nice thing with it, like we were talking about the pain, is it reduces the alpha and gamma firings. And so when it drops the temperature of your muscles, it also helps with any type of muscle spasms. And it does help with the migraines. Like I said, in the past, I had a lot of migraines from previous injury, and just growing up, I've always had a lot of migraines. And a lot of times when you get in there, your neck will be really tight. When you come out, it's nice and loose, and it's almost euphoric, what it does with what it does for your head and the migraines.
Okay. So I'm going to kind of jump in with a little segue since you mentioned that aspect of the migraines and such. So, how far do you have to be, quote unquote, submerged into this chamber? Because most, I think, have people's heads outside. I'm sure your daughter's going to kind of demo this for us so we can kind of see it. But I know some of my patients, and rightfully so, have some issues with claustrophobia. So I would imagine even if you have headaches and it's an issue, you probably are able to get benefits by having the rest of your body kind of within the context of the chamber. Can you talk
Correct.
a little bit about that?
Yeah. So everything, your head will stick out of that chamber. And like I said, the door will close. I can actually put Morgan in there right now if you want.
No, don't have Morgan in freezing temperatures just yet. We got a lot more questions. We don't want
So,
Morgan hating us just yet.
I'm going to open the door and see.
Okay.
Hopefully you can hear me. So can you hear me?
Yep, we can hear you.
Okay. So that's the chamber. And what we do is we have these risers that we put in there, and depending on how tall they are, we will build a base up. And then what they do is they'll stand in here, and then this will flip over the top, and I don't have it tall enough. And then their head will stick through the top. And the door will close, but it doesn't latch. And so if anybody's claustrophobic,
Okay.
like I said, I'm standing right there and I'll let them out right away.
Okay. So on your website, you talk about that it can reduce pain, particularly for rheumatoid and osteoarthritis. And as we know, those are kind of two divergent components of arthritis. One is from kind of wear and tear, and one is much more of a systemic type of disease. Have you seen this in people who have these type of problems and they've gotten some degree of benefit?
I have. I'm probably the one with the wear and tear, and I can vouch that it does help with that. I have a couple other clients. I had one that really sticks out in my head, and she has horrible rheumatoid arthritis, crippling, her hands and her feet to the point where she's had surgeries to have her joints replaced. And she started coming to me the first time. First month she came twice a week, and then the second month she came once a week, and then now she comes once a month. But it was after doing it 3 months, it was the first time that she was able to push mow her yard in 7 years, and she was just ecstatic. And right now she's living a pretty decent active life. She comes in now just as she needs it when she's feeling really, really sore, and it just helps with that inflammation, gets her back on the road to being able to do things.
Okay, we have another question coming in. So this is from Elaine, who I know personally, who's a phenomenal nurse in the Chicagoland area. And what she's asking is, does it help for facet arthropathy?
I'm not sure I know what that is, to be honest.
So let me kind of pitch hit and kind of run interference for that. So facet arthropathy is arthritis within the joints of the back. And in essence, it's going to kind of give you those problems. Like if I was going to pick up a quick model here, that would be present within the context of in here, right? So if you have pain when you twist and you turn and you bend, when it gives you a problem when you first wake up in the morning and you're trying to get out of bed, or if you've done a lot of activity and you've been in the garden, or if you're a golfer, those type of things are like really exacerbated with the aspect of facet arthropathy. So that's what that is.
I have had a couple people that has helped. I also have a gentleman that is a police officer that has scoliosis of the spine, where it's kind of bent backwards, and it's done a lot of good things for him too. I have some people that have worked in some factories that have a sciatic and a back twisting issue. And after she went to the chiropractor, they sent her to me. And after about 4 treatments, she was doing much better too. It hasn't been back because she's been doing well.
Okay. So I know that it's been mentioned and is present in some of the literature that it may even be able to help for neuropathy. Can you tell us a little bit about that?
They say that from literature, and I haven't actually experienced a lot of neuropathy yet. Um, Again, we were gonna try. My dad has neuropathy, and he just came back from Florida, and this was one of the things we wanted to try to help with his neuropathy, but with his brain bleed right now, we don't want to chance it. I have another person that has neuropathy from the chemo treatments from their cancer patient, and it has helped with that. That's about the only neuropathy that I've actually dealt with so far.
Okay. I have another question that's coming in. People are just loving what you got going on here. So what Vicky says and what she's mentioning is that it sounds like phenomenally great therapy, but I can't stand for more than a minute because she uses a wheelchair. I'm not sure if there are chambers that are out there or if your chamber can be able to accommodate. But before people that have challenges being able to stand, is there anything out there to be able to help them?
They have mine's a whole body cryotherapy. They do have localized cryotherapy, which I don't have yet. That's one of the things I want to add to our center, which will treat individual, like, knees or ankles, or I could spot treat. Um, Depending on what she has going on, I also do something that's called bioenergetics microcurrent frequencies. And what that does is, where's my machine? I have a machine that I can actually use. Looks like a little cell phone, um, and it puts it's smart tens, a skenar biofeedback, and a pulse electromagnetic frequencies, and it puts corrective healing frequencies into your body so your cells can heal themselves, depending on what you have going on. It has all kinds of settings like cervical spine, thoracic spine, just about every type of organ, or knee pain. It has all kinds of different settings, which might be something that would help her instead of the cold.
Okay. So I think we've covered some of the aspect of contraindications to the aspect of cryotherapy. You mentioned something about spasms and spasticity and muscle spasms and such. How quickly does that go away? Does it impact it considerably or just a little bit? What's been your experience and exposure when you've been dealing with those type of things?
Well, everybody is different. Everybody has a different level of pain, a different level of healing, different level of crisis, depending on what they have going on. So it really is on an individual basis. The muscle spasticity, like I said, it drops the temperature and helps with the muscle spasms, helps reduce the pain. It's really good for people with AS, helping with that. I had a client that came to me, didn't have AS. She came to me because her mother-in-law used to have AS. And before this was around here, before her mother-in-law unfortunately passed away, she used to fly to Florida once a month just to do cryotherapy treatments for her AS. And so when this girl found that I was here, she decided to come just for her overall well-being. So it does help with that. And again, it depends on the person. I have another individual that came in with severe knee and hip and lower back issues and couldn't walk very well. She couldn't do stairs. She used to be a hairdresser, and she kind of waddled when she walked, and it drove her nuts. And for example, for her, she left the first time about 80% better. It gradually, the inflammation crept back in. She came back a week later. She's been here about 3 times and texted me today and said she's about 50% better, and she's going to continue to stay on schedule and get on maintenance until we can get to the root issues.
Okay. So we have another question coming in. Unfortunately, this time it's coming to me. So they're asking me, Dr. Landrum, do you have a radiotherapy treatment that uses a freezing process? So I'm going to make a little bit of a divergence and kind of answer this question real quick. So there's a number of different things from a radio frequency component that fit within the context of your question. But traditionally, radio frequency is going to have the application of heat. If you go to our website or you look up certain things, you'll have things that are listed as cool leafed or cooled radio frequency ablation. As a matter of fact, if you go back, I want to say maybe 3 episodes now, we actually had someone on who talked about cooled radio frequency in its depth and detail, but it's the heat that's applied, but how it's just applied there is water that's cooled at the time that the application of the heat is. So instead of you getting kind of a searing sensation where the heat is all applied at once, it's much more evenly distributed. So that's what cooled radio frequency is. The other thing that's actually the utilization of cold is cryoablation. We're actually looking at a product that's called iovera, IOVERA, that can be able to treat the nerves that are typically associated with joint problems and other issues with that application, but it doesn't have the same benefits as something like this might have, which is total body that can be able to target multiple different parts of the body all at once and be able to improve inflammation. It's more of a discrete targeted modality in therapy. So getting back to the aspect of cryotherapy in particular, exactly how is it done and what's your recommendations for how often people should repeat it? Should you start feeling the symptoms start to come back, or do you need to get ahead of it and try and do some other things first? Or what are your thoughts for what's the routine use for many people that may have pain or soreness or spasticity of some sort?
For overall wellness, general wellness, they recommend 1 to 2 times a week. For people that are recovering, like athletes or injury recovery, they recommend 2 to 3 times. Any type of arthritis, injury, they recommend 3 to 5 times a week. Now, that's the recommendation that they tell all of us. After having all the experiences that I have had and doing everything, that they recommend, you need to do this 3 times a week. And, sometimes people find, again, it's individual. Some people find, hey, after I did this twice, I feel pretty good. Maybe I don't need to go that 3rd time. So I advocate for people to listen to their bodies, listen to themselves, see how they feel and what they want to do. Again, it depends on how much inflammation you have. Usually if somebody is really, really sore, just like my lady that came in with the knees, she came in twice in 1 week, and then she came in a 3rd time the 2nd week, and then she's coming in again this week. So she didn't need that 3 times a week, 3 to 5 times a week.
Okay. So can you tell us how long a cryotherapy session lasts? Is it a length of time that's regimented from person to person, or is it variable or not variable? Can you give us some ideas about that?
Because it gets so cold, we cannot have somebody in there for more than 3 minutes. It's recommended the first visit that somebody does it for 1 minute at level 1. Again, I really monitor how the person's doing and how they feel. A lot of times, once you get them in there and you talk to them and you get them settled, that minute's over and done. So a lot of times I'll set it for the 2 minutes or 3 minutes, and then I just talk to them. And if they can go the 2 minutes, then we'll go the 2 minutes. Usually the first time I don't go more than 2 minutes. The second time and thereafter, I'll always do 3 minutes, as long as they're comfortable with 3 minutes and they're okay. And then we'll also, like I said, the first time or two, I always do it on the low temperature just to get them used to it. And the first time that you do it, like I said, I'm not gonna lie, it's cold. And a lot of times what happens is I'll set it for 2 minutes and they'll be like, let me out, let me out. I'll let them out. And then they'll be like, how much longer did I have? I said 30 seconds. And they're like, oh wow, that wasn't that bad. Because the minute you step out of that, your body starts heating itself back up. And so you'll feel cold to the touch, but you won't feel cold to the core.
Oh, okay. So initially, when I was hearing that, it was just making me think about like an ice tank, like you'd see on the old school Fear Factors and such. And how long can you hang in there? But I'm sure, given the degree and the benefits of everything that it has in place, that it becomes kind of addictive in some ways. Where if you can be able to knock that pain out of wherever you have it, the knee, the hip, the shoulder, and it only takes about 2 to 3 minutes. I'm sure there's a number of people that are finding ways to be able to kind of accommodate and deal with that. Can you tell us about a client slash patient that you have impacted them so much where they really touched your heart? And then I'm going to give you a challenging question. Can you tell us about someone that you didn't expect to get benefits that did, and what were they?
Well, everybody that comes in here touches my heart. That's why I'm doing this, is to allow people to be able to live a better life, to be able to live a more comfortable life. Um, Probably my lady that came in and told me that she hadn't mowed her yard. It was the first time she mowed her yard in 7 years. That about made me cry. The lady that I was just talking about with her knees, um, today actually was the day that her and her husband were going out to celebrate their anniversary. And she had been wanting to go for a walk. Her and her husband always used to walk, and there's a certain park that they have been wanting to go to since they've been married. They've been married about 8 years, and she hasn't been able to do it. And so when I texted her today to tell her to enjoy her date day, she was really excited because they were able to go to the park and walk, and that's what she really, really wanted to do. So that really touched me. What was your other question about?
So the other question was in relation to was there someone that basically how much they improved surprised you, and you're able to see, oh wow, I thought that they would get this benefit, but not only did they get that, but they got more than what I expected.
Hmm, I can't think of anybody really in particular. A lot of times people will come in here and they think that they're just going to get in here for the pain. I have a friend of mine that has some anxiety issues, and she was coming in for pain with her back and didn't realize. And I kept telling her, it's going to help with your anxiety, it's going to help with your mood, it's going to help with your depression, because she's just in a very stressful job. And she felt better after her back, and then she texted me a couple days later and said, wow, the stress at work isn't bothering me, and I'm not having the anxiety attacks at night. So she's actually coming back this week too. So um, it really surprised her. Didn't really surprise me because I know what it does for anxiety and the mood set and your mindset. It really helps with that.
Okay. So, um, within the context of all of this, what is your biggest area of like curiosity that you're still kind of like saying, you know what, I wonder if this added to what some people have may even be more impactful in terms of their life and functionality? What are some of the things that you're curious about right now?
Well, for the last couple of years, I've been studying, like I said, bioenergetics. And bioenergetics looks at the person's overall energy field. Um, some people think it's a little out there, but the more I study, the more it just interests me and makes sense. It's based on quantum physics, and I do two different types of modalities, and both of them deal with quantum physics, looking at our overall energy field. Basically, our cells need energy to heal themselves. Our cells, our DNA cells have to communicate. And if our cells don't have the energy and they don't have the correct information to communicate, then they get sick, just like we get sick. And then our cells will then kind of lump together on, just like when we get the flu, we pass it around. Well, that's what happens when our cells don't have the energy, is they get sick, and then the next one attaches to it and it gets sick, and then it eventually can lead to some types of diseases. And so what I'm studying and have been, I became a practitioner for a company that is called Ness Health, and that's what this little machine does. But also with this machine, I can treat people symptomatically. So if you come in and you do the cryo and say your knee hurts, I will do the cryo, and then I'll run muscle, and I'll run nerve, and I'll run knee joint to help free up the blockages within your knees. But the really cool thing with this is it's very similar to acupuncture. So just like people do acupuncture and the needles clear those energy blocks based on Chinese medicine, this will do the same thing. I can hook this to a computer and it will scan your energy field, and then it will tell me the different acupuncture points that I need to use this on to free up those blockages. It also, the really interesting thing, and maybe I'll come back another time and just do a whole section on this, is when it scans your body and your energy field, it will tell me what your diet is, what your hydration is, if you're sleeping, if you're getting enough daylight, or if you're not getting enough sleep. It'll tell me your polarity to the ground. It will tell me your energy flow through your body. So in Chinese medicine, like you have meridians, you have a kidney meridian, a gallbladder meridian, you have all these meridians that affect different points in different organs of your body. And this will tell me the energy in those meridians, right down to, like, for me, it'd tell me right down to the AV nodes in my heart what the energy level was in that particular area. It tells me, nutrition, what you're sensitive to, maybe what you're low on certain vitamins. This part is not on my website. So this is just an added, we haven't got that on the website yet. So I'm still learning that. Like I said, I became a practitioner for this. I've been doing it for about 2 years. What I mean by I'm still learning is there's so much to learn. There's a bunch of information on how this helps with the vagus nerve, trigeminal nerves, and it reads all of that within the scan. So I'm excited about that. I think it's going to be, I have a lot of clients that just come for this and don't even actually do the cryotherapy. I have some that we do cryotherapy, once every other week, and then we do this every other week. It just depends on what they have going on.
Okay. So maybe this is kind of the context of one of the things that you're talking about with Ness Health and kind of that aspect of human body field to kind of get to sort of the aspect of the root cause. So let's talk a little bit more and really kind of get into the full gist of how you can be able to provide benefit further. One quick question from our audience is Vicky, I believe, is asking, do you do bioenergetics now, or are you still studying?
I do bioenergetics now. I've been doing that about 2 years, and I'm still studying some aspects of it because there's so much to it. I just want, it's kind of like medicine. Some people concentrate on knees and backs, and so I'm just right now I'm trying to concentrate to learn a little bit more on the vagus nerve and the different things that the vagus nerve does. Partially because of my hearing issue and some other things, I'm just trying to figure out a way to bring that back.
Okay. Well, again, thank you for being able to join us and kind of give some of the information that you're doing. I mean, I don't think many people know all this much about cryotherapy. So, with kind of getting to that same element, if you could have a billboard that you'd have on anything, what would it be and why?
You asked me that, and I had to write this one down because I had to think about that. I actually didn't have to think about it long, but I want to say it correctly. So, my billboard wouldn't have anything to do with the cryo part. It would say, "You don't have to move mountains. Simply fall in love with life and yourself. Be a tornado of happiness, gratitude, and acceptance, and you will change the world just by being a warm, kind-hearted human being."
Okay. So, that is very much a value statement of
That's
where
me.
you're coming from and how you kind of approach the world.
Mhm.
Noted. All right. So, what are some things that people probably misunderstand about cryotherapy? Can you be able to dispel some misunderstandings?
The biggest misunderstanding is probably the fact that people don't like the cold and they feel that being in the cold makes them hurt. Just like in the winter, we have that damp, wet cold, and it does. It makes people's bones ache. This doesn't do that. It's a very dry cold. And so like I said, it doesn't go bone deep. It doesn't go core deep. So it's really not as cold as what people think. So that's probably the biggest misnomer. And the other thing is just educating people on all of the different benefits that it does have. Even when I first started this, it was really out there for athletes, and everybody thought that it was only good for athletes. But me being so broken and having many other people that have come to me that just have injuries or health issues, I think it's just as beneficial, if not more beneficial, for people like me and others that are just hurting and want some type of pain management without having to take a pill for this or a shot for that. I used to have to get injections in my neck uh, regularly, in my knees, and I was taking all kinds of different medications. And that's when I said, enough's enough. And can, I'm pleased to say that since I've started my nutrition classes and my coaching classes and all the different things that I've done, and with this and the bioenergetics, I have been completely medicine free, shot free since 2017.
Wow. I'm sure there's a number of our patients that would love to be able to get some better understanding about that.
Not and I'm not saying that we don't need that, because we do. I mean, we need medicine, and I've just found that it's a really nice marriage between the two.
I
And
think, Nicole, I mean,
that's the bad thing with the nitrogen tank. It builds pressure and then blows off. It's just a really nice marriage to um, really get to somebody's root cause and figure out what they need.
yeah, what I would say is, Nicole, I think a number of our patients, what they want is to be able to get resolution that allows for that quality of life. And for us in our practice, we're not trying to have patients come back to us for meds and injections multiple times if we can. What we want to do is to be able to solve that underlying problem, or at the very least, give them something that's going to be palatable to their lifestyle. So if cryoablation takes needles and pills away from them, by all means, that's our goal. So
Yeah.
let's go do it. Let's kind of punch pain in the face and really get our lives back to really be able to lead the lives that we deserve.
And
So,
that's kind of why I say, yes, I could recommend that they come 3 to 5 times a week, but again, it gets expensive over time. So that's why I always tell people, look at your body and see what you can do. Just like with my knees, I can go a good 3 weeks now before I really have to be in here where I start aching.
So to that end, since you mentioned the aspect of expense, do you feel comfortable kind of giving patients slash clients an idea about like what they might be thinking in terms of like if they were having to pay a certain amount, or Do you have package deals or things like along those lines to help individuals, or what are
I
your?
do.
Okay.
So first time is $35, and then after that, a single session is 40. But I do have packages of 3, 5, and 10 that drops it down. A package of 10 drops it down to $30 a session, so it'd be $300. I do on my website have some monthly memberships, but I'm thinking about changing that because I'm actually finding that the packages are probably a better deal than unless somebody's going to come every single day. Because on the memberships, I have some people that come, 3 times a week or daily. But the thing with the monthly memberships is it's you use it or lose it for that month. The nice thing with the packages that I find and feel that are better is I just keep track of, say they bought a package of 10 and I keep track and I don't have an expiration date on when that expires. And I do have a husband and wife that come and I actually let them share that package too.
Okay. So if you could tell your 18-year-old self things to prepare you for your life, what would you tell her, so that she'd have, quote unquote, an easier or more fulfilled time? What would be your statement that you would give forth to her?
Well, based on my experience, because I was that kid that would fix every stray cat or dog or, try to help every single person that needed help. Um, I would probably tell myself that I need to, in addition to taking care of other people's needs, I need to take care of myself and take care of my needs instead of constantly putting yourself on the back burner. Because when you constantly put yourself on the back burner over time, that's when you run out of energy and you start getting sick, and then you're no good for anybody else.
Okay. So what are some of the best resources for people to learn more about cryotherapy?
Um, Probably the internet's always a great resource, but then you've got pros and cons. You have people that'll have that negative tone too. PubMed has a lot of different stuff on cryotherapy. I'm going to try and start doing more blogs on my website. What I didn't say is this is not my full-time job. I'm actually still a school teacher and
Sure.
I teach at the Career Center. So I teach firefighting and crime scene investigation, which is actually my full-time job. So during the summers, I'm here during the day, all day. And that's why my website says by appointment. I'll meet anybody any time of the day or night, or I don't care if it's Saturday or Sunday, I'll meet them. So we're kind of open on what the clients need.
Okay. So you mind giving us this demonstration with your daughter so we can kind of see exactly what does this entail?
I can. It's going to get a little loud, so just hang on a second. And Morgan, this is Morgan.
Hello.
Hi, Morgan. Thank you for joining us.
You're most welcome.
All right. So when people come in, they have to wear a pair of our socks. This is not a designer show or a fashion statement. I'm gonna say that right now. Um, the reason I want people to wear our socks is because I want to make sure that their feet are dry. Because even though you think your feet are dry, they may sweat a little bit. So I want to make sure, and I have towels that if they feel that they're sweaty, that they dry off. They're going to wear our socks. They're also going to wear these lovely fashionable little booties. This is just to protect their toes and their feet from frostbite. Even though you're only in there 3 minutes, it does, our digits are thin. We don't want them to get cold. Then the other thing that they will also wear is a pair of gloves. Now, people, the less is best. So Morgan usually goes in her sports bra and shorts. Some people just go in their bra and underwear. I actually have a couple ladies that don't like to wear anything, and that's fine. That's totally up to them. And then, but men have to wear underwear or shorts. I have robes. Morgan, let me have that. I have robes that, if people aren't comfortable in their shorts and things, I have robes that they can put on. And so basically, once I get going, because it's going to get loud here for just a second, is I'll pre-cool the machine, and then the client will step into the machine, and I'll close the door. They'll hand me their robe. I'll hand them a pair of gloves to put on, and then I will turn the machine on for 1, 2, or 3 minutes, and we'll run them through. Morgan usually only does 1 minute to 2 minutes. Again, like I said, she has that Raynaud's with her fingers, and actually she just got, a month ago, she just had a surgery where she was diagnosed with slipping rib syndrome. So she just had 2 cartilages taken out between her 8 and 9 bilaterals. So we're just trying to work her back up into the cold, and it has helped her with the inflammation and things with her ribs too. So, and she starts PT this week, so it will help with that. So I'm going to step away for a second, and I'm going to get this ready, and I'll be right back.
Well, guys, thank you for joining us. We're going to have this demonstration, but for those of you who have been seeing us on Facebook, I do just want you to know that not only do we have this, but we also have a YouTube channel that gives more in-depth and detailed information about some of the offerings that we have for pain management, for regenerative medicine. So please check that out. There's a couple different ways to be able to access it. The first is going to Cutting Edge Pain Relief, as you can kind of see in that banner below. The other is by being able to kind of sign up with our newsletter by going to cuttingedgepain.com/newsletter. Either of those two can be able to provide value and be able to give you something more that you wouldn't have otherwise seen. So subscribe to our YouTube channel and check us out.
It's going to take just a minute for that to pre-cool. So every time somebody comes in, if I don't run people back to back, I have to pre-cool the chamber so it's cold before I run a session. I'm going to mute it just for a second, and I'll be right back.
So again, we're here with Nicole Dyer from CryoEdge Elite Performance and Health. They do cryotherapy for a whole host of different conditions, but particularly for those individuals who have pain from osteoarthritis, rheumatoid arthritis, neuropathy, muscle spasms, muscle spasticity, all those type of things. You can be able to get some degree of benefit without us having to be reliant upon drugs or surgery as a mainstay of treatment, and may be able to be preventative so those things are never needing to be implemented. If you found this of value and you're watching this not during the live stream but at a later date, please subscribe to our YouTube channel so you can be updated about other future endeavors. We actually have a number of different elements that fit into modalities like this. And if you have questions or you have interest about other topics that really appeal to you, by all means, please leave them in the comment area so that we can be able to pick up and seek out individuals who can continue to be able to provide relief that may not be along the most beaten, well-trodden track. But we don't care about that. What we care about is being effective and making sure that we can be able to deliver relief, so we can be able to teach you how to biohack your pain, punch pain in the face, and really be able to get back to leading the life that you deserve.
Okay, so it's pre-cooled, and I'm gonna put more. Can you hear me? I hope you can hear me. I'm gonna put Morgan in right now. So I'll have everybody duck so I can put the lid down. The door doesn't lock. And then once they have their gloves on, we're going to hit start. And so while they're in there, it's liquid nitrogen that we use. And so everybody has their heads out, but I usually have them tilt their chin up just a little bit. That way they're not breathing the nitrogen. The nitrogen won't hurt them in the short amount of time that we're in here. It just looks scary, especially for the first time. And while they're in there, every 30 seconds I have to hit a button. It's a safety override. So while they're in there, depending on the person, I usually tell them to march in place, walk in place. I have them spin around because the nitrogen, the cold comes out of the back. That way it evenly distributes. As you do this over time, like when I do it, I just kind of stand in there, tilt my head back on the ledge and relax. You get used to the cold after a little bit.
It seems like she's used to it. Like she's like, no big deal. She's got a little bounce that's going on, but she's like bouncing in rhythm, like she's dancing. We just need some music and some strobe lights kind of going on at the same time. She doesn't look like this is bothering her at all.
She knows the benefits because she's a long distance runner. She doesn't like cold. I'm going to be honest. She does not like cold, but she knows what the benefits are. With her running.
Yeah.
Yeah, when you see like reporters try this like on TV, their whole face is like shaking and they're moving back and forth. This is not bothering Morgan at all. She's like, oh yeah, bring it on. Okay. I think that's going to encourage a lot of our viewers to be able to say, you know what? I think we could be able to do this.
All right. Morgan is done. It is a lot of mind over matter. You ready? Yes. Okay.
All good.
Thank you, Morgan. Really appreciate it. That was phenomenal. All right. So where can our viewers find out more about you online, and where can we find you, not just virtually, but physically, so we can be able to actually...
Sorry, that's the downfall about doing this in here. So our website is CryoEdgeElite.com, and on that website is
Yes.
and shut that off for me if it blows off again. And on the website is my cell phone number. I have everything going to my cell phone right now. I didn't want to do an online booking. I've done that before, and it got kind of confusing for some people. So for me, this just works easier, and I find it easier for my clients too, just to be able to call me. We're located on County Road 17. I am in Amberwood Terrace Chiropractic. And so we're right, if you know where Bullard Farms is, we're right there on the corner. So in Amberwood Terrace. Right now, I don't actually have a sign out front. So you're just going to have to look for Amberwood Terrace Chiropractic. And that's where we're at. I'm on Google Maps too, or Google.
Okay. So you are a well-kept secret, but we are happy to be able to have you here on our channel and be able to publish you for our evergreen content on YouTube, so people can constantly be able to find out about you, what you guys do, and how you're able to help benefit people. So I got 2 more questions, and then I will let you guys go to be able to enjoy your day. The first that I would ask is the following is, so what unique skills do you feel like you have that really helps you be able to leverage this and be able to help people?
Well, I would say probably my experiences and understanding where people are coming from. I may not have the exact injuries or issues that they have, but with my 30 years of being on the fire department and doing EMS, I have just seen a lot of different things and how people feel. I'm very compassionate. I love to listen to people, which is probably, I always schedule when people come in here. The cryotherapy actually only takes about 15 minutes, but I usually always book everybody out for an hour because I tend to listen to what they have going on and talk them through some things, because like I said before, a lot of times some things are people just need to vent, and some things are more emotional than they are physical, and it comes out into a physical ailment. So that's probably my biggest quality, is being there to listen and try to guide them or help them with what they have going on, or even if it's something that I can't help them with, get them in touch with who might be able to help them better than I could.
Okay. So, last question. This one is the one that's kind of that deep, thoughtful one. So, if you were looking back on this 3 years from now, what has to have happened, both personally as well as professionally, for you to feel like things have been successful?
Um, you're getting a lot of my inner being here. For me, because of experiences and things, I would say just being happy in the present moment, um, being successful personally and professionally is something that lies within ourselves. We have to find it within ourselves. And in order for us to um, actually grow, we have to put the work in. We have to do it. You can't expect other people to do it for you. And there's a big difference between success and satisfaction. And for me, I'm satisfied with just helping people, and being satisfied helping people is also my success.
All right. Again, Nicole, thank you so much for joining us. We really appreciate you coming on with us. And hopefully, you may come back again, possibly to talk about PMF and NES, and kind of give us some further insight about how you're using that and how you're helping patients and other individuals. So maybe you'll be open to that in the near future.
Sure. Thank
Okay.
you for having me, and I'd love to come back and talk about the bioenergetics, because it's really interesting also.
Very cool. All
Okay.
right. So, um, we thank everyone for attending and coming to come see us and listen to this discussion about cryotherapy and hearing specifically about CryoEdge Elite and what they're able to bring to the Michiana community. If you missed parts of this video, by all means, check us out on Facebook. But the other place to be able to find us is on YouTube under Cutting Edge Pain Relief. And we have people thanking you for joining us as well, not just for me. That really just enjoyed this interview immensely, and we appreciate you coming out. Thank you so much. And if you have questions, leave comments, and we will forward them on to Nicole, as well as being able to connect people who want to attend and be able to go forward with potential treatment. Thank you.
Thank you. I don't know how to get out of this.